just curious, so like you work with these neurosurgeons and very specialized. So do they refer the patients? Like you work together? How the interaction works in regards to that?
So the clinic that I helped develop, it's owned by Michigan Ear Institute because they're a group of 9 to 10 surgeons, and they're all amazing in their own way. And what they realized was that when they would send people for physical therapy, for vestibular rehabilitation to different places, the people would come back and they would say, well, I'm not better, I did therapy. But they couldn't figure out if it was the therapy that was not done well and that is why there was no recovery, or was it that the person just is beyond therapy and needs something else or cannot recover. So they wanted to control that variable factor. And so they decided to go ahead and open their own clinic. And so they bought into this franchise called Physical, and so we're owned by the Michigan Ear Institute. And so they do refer a lot of patients that they feel are at risk for falls, or people who have, benign positional vertigo, have their crystals out of place and need to be repositioned, or maybe they are multifactorial. They have, you have an 85-year-old who has BPPV, but maybe they also have a hip replacement and whatever else, and they haven't moved in 6 months because they're so scared, and now with the virus, they haven't left their house. Yeah. So we get a lot of people who have multifactorial issues, but we also get 20-year-olds who have maybe a concussion or had other reasons why they are dizzy or off balance or have issues. And so to figure out what it is that the person needs and cater to that, make it appropriate.
Nice. I think it should be
I don't know. Did I answer that question?
Yeah,
I think I went on it.
No, it's fine. I think I was just imagining here, like, it should be great to work with these clinicians so closely and exchange information about the patients and how the cases are progressing. I think it should be like perfect, right? Makes our life so much easier.
Absolutely.
Yeah.
And I think they appreciate it because they know who the person is going to. I feel blessed to be able to work so closely with them. Because, if they are not sure, they can refer, and then we refer back, and it helps. It's almost like you're caring for the person in whatever way that patient needs,